As two practicing physician assistants, we've seen a lot and we've heard a lot. We know that you've heard a lot too. We are here to help you navigate through the BS by having open and honest conversations with other practicing professionals. I'm Heidi.
And I'm Cassie, and welcome to Mindfully Woman.
All right. Well, welcome back to the podcast, everybody. We have another great guest today. We are full of these amazing guests, and we are so excited to introduce you all to Lisa Lahey. She is a nurse practitioner and also an international board certified lactation consultant, and she runs her own practice. So welcome to the show, Lisa.
Hi, thank you so much for having me. Heidi and Cassie, it's my pleasure to be with you guys and chat and tell you what I know about helping babies and a little bit beyond that.
Yeah, we can't wait to hear it. I know we were talking a little bit before we got started, but we always just like to start off the show with telling the audience and everybody a little bit about yourself, kind of how you got to where you are today.
Sure. Well, I've been a nurse for 29 years. I really love nursing. I feel like that was the right calling and the right job for me. And I've always been surprised where nurses can go with their career. So I started out working in the hospital, both in labor and delivery, postpartum, NICU, peds. Essentially, if it was in maternal child health, I've done it. I did work 2 years in the adult ICU and decided that was not for me.
That's a big difference.
Yeah.
It was neuro ICU at that,
Oh.
but I was very excited for that opportunity, actually, because I think when you work in the ICU, you get very comfortable with your assessment skills and your critical thinking as a nurse, and you're dealing with very complex issues. And I realized that that's why I wanted to become an IBCLC, because I thrived on helping people not only with the joyful issues, but most of the time, if breastfeeding is going well, you're not seeking additional care, right?
Yeah, that's very true.
Who do you go and see? Our physicians, as well trained as they are from the medical standpoint, don't always get a lot of extra help when it comes to feeding and nutrition in their clinical residency programs. And then if it's an interest for them, they're like the rest of us, going to a weekend course or a certification course to try and learn more. So that's really where I think I got my love for the complex. I kind of like figuring out those big problems when babies are having feeding issues, or if a woman is having, difficulty with some complex things such as mastitis, a breast abscess, hormonal dysfunction that might be causing reasons for low supply or oversupply.
Awesome. So did you feel like when you were in this midst of your career, did you see a lot of issues like with babies and feeding, and that's kind of what you decided to be like, that would be really cool to kind of help figure this out? Or was there like any one-stop factor that kind of drove you to say, I'm going to really start driving into lactation?
I would say, for the most part, when you're just seeing patients in that 2 to 4 day postpartum period in the hospital, it was really about getting parents off to a good start with their newborn, with both feeding and newborn care, and kind of what to expect as you transition to home with your newborn. And I didn't see a lot of complex issues until I started kind of like a weekly outpatient clinic. And then people were coming back into the hospital, and physicians were sending referrals for babies who weren't latching on, who were still below birth weight, who were struggling, or maybe they had some syndromic issues such as cleft lip and cleft palate. They were discharged from the NICU at 33 weeks and trying to figure out how to get breastfeeding better established with a baby who might be more medically complex. So when I worked at Community North, we had that outpatient support group and outpatient clinic. So we would see patients by appointment, and that really grew under my leadership. And we went from like having 10 moms a week to 40 moms a week.
Oh, wow.
It was a lot, and we had 3 or 4 of us working it at that time. But I like to call it breastfeeding ER because I was like, "What's gonna walk through the door today?"
Yeah, really
You had
though.
to, yeah, you really did. You had to have your roller skates on, and again,
Yeah.
those critical thinking skills of like, okay, what's our chief issue and complaint, and how am I going to do kind of this assessment and get this mom and baby moving in the right direction.
Hmm.
So that was 10 years ago. I started my private practice and my clinic 10 years ago. I turned 40 and I was like, all right, it's now or never.
Yeah.
Kind of like change game plans. And that really took a leap of faith, I will tell you.
Okay.
Because we as nurses have an awesome job of educating our patients, and I felt really sound with my clinical judgment skills. But I would say it was the business part of owning your own clinic that I was like, wait, I don't know how to
Yeah.
do all this.
Yeah.
Um, and so I found that challenging. And if you asked me today, I could see patients all day long, 5 days a week, like I do. It's the accounting, it's the
Hmm.
emails, it's the appointments, it's submitting things to insurance. It's like all of the medical side in the business of medical side that I think is very challenging for practitioners to kind of get out of the system.
Yeah.
Hmm.
That's hard. That's the things you don't hear about and things you don't learn about unless
Yeah.
you dig in and maybe talk to like people that you know that have done it.
Yeah.
So
And
kudos to you. That's
yeah.
great. That's amazing that you've done this for yourself. I mean, going back, would you do it, 10 times over? Are you happy you made that transition?
I would.
Yeah.
And if I have any regret, I would have done it earlier.
Okay.
And the same with like seeking out to be an NP. So I've been an NP 5 years, and um, I always had intentions of going back, but I had my own family to raise, and I have 5 children of my own. And so life was busy. And so when my
Hmm.
youngest went to kindergarten, again, I was kind of like, I'm going to do this. This is going to happen. And I'm just so glad I did. I feel like I can help more people. And then, as we were talking about earlier, I started to see older kids and adults also for oral function issues. And I still see about 20% older kids and adults for just well visits, coaching, looking at their labs, helping them to kind of reach some wellness. Because
Hmm.
again, I think in our hospital systems, we only have a limited amount of time with patients where in private practice, you can take an hour or an hour and a half to like really dig deeper. And that is a unique opportunity to impact wellness in a different way.
That's
Okay.
amazing.
So is that how becoming an NP you were able to change the like going from a nurse to an NP, you were in the middle then of having your clinic, is that correct?
That's right. Yeah.
Okay.
So the first 5 years of my clinic before I became an NP in Indiana, we don't have full independent practice.
Mhm.
You have to have a collaborating physician. So I do have a collaborating physician that, looks at my prescribing charts, and there's an understanding that, if you need to reach out to them for extra advice or help, you would do that. Where
Mhm.
we're really lobbying in our state to get full independent practice because obviously there's some monetary involvement with that.
Mhm.
And many nurse practitioners know that we need physician partnership, but it can be prohibitive to starting your own clinic and finding a collaborating physician to do so, where many other states, I think now 38 states, have full independent practice for the
Wow.
advanced
Wow.
practice role.
I
So
didn't
that
know
is,
that. That's a lot.
yeah,
38
it's a lot.
states. Huh.
Yeah. So yeah, it allows me to like fully prescribe, treat, and diagnose. And, again, I didn't need that when I was working as a nurse and lactation consultant because mostly I was helping mothers and babies with feeding challenges,
Mhm.
but I would see complex cases and refer them. And sometimes I'm like, there's a gap or there's a wait. And I'm like,
Right.
if I could prescribe them an antibiotic because I know they've got mastitis today, I could get them on that road to recovery a lot quicker.
Mm-hmm.
So that's kind of how it started. Um, when I worked in the family practice clinic and did my preceptorship, I worked under a physician who had functional medicine training, and I have some functional medicine training too. And that was really helpful, again, at just looking at more root causes of like, okay, well, why does she have this thyroid issue or
Mm-hmm.
this autoimmune disease? And what else can we be doing with our medications, like supplements or lifestyle changes or coaching to really
Mm-hmm.
get that patient more optimal. And if you guys ask me, I think for women in particular, pregnancy is the first time that you start thinking about your health a lot more seriously, because
Yeah,
before then you're like,
totally
okay,
agree.
I can go to the doctor every once in a while.
Yeah.
But now you have a human being that's relying on you, and you might
Mm-hmm.
have some of these challenges with your health where you're like, oh yeah, I had some hormonal dysfunction with my cycle. I had polycystic ovarian syndrome, and those can relate to some of the lactation challenges that we see with like low supply, for
Hmm.
example. So some women who have low supply, they typically have a history of insulin resistance, polycystic ovarian syndrome, sometimes infertility. Not always does that mean you're going to have low supply, but
Yeah.
there's some hormonal dysfunction because obviously pregnancy and lactation were at the peak of hormone function.
Yeah. That makes total sense.
So do you, in those particular groups, do you try to like help treat those issues too to kind of help get them to where they are? Or do you work closely like with their providers to create like the best well-rounded picture, or both?
Oh, both.
Yeah.
I would say both. So, again, like I might draw some labs or, order labs and evaluate those and then make some recommendations. Sometimes I've referred for sure to endocrinology because I'll catch someone, I'm like, this is beyond what I know.
Yeah.
And I've got a couple of like patients with Cushing syndrome or things like that.
Oh,
Like,
yeah.
wow, okay, this is why we're making no milk at all.
Oh my gosh.
Oh.
Strogans, just some different things that I think often get missed as kind of
Mhm.
like, okay, well, breastfeeding's not working out, just switch to the bottle. And I always say that, yes, we're really glad that we have a bottle and formula or pumped milk that we can go to if baby's
Mhm.
not able to do that directly. But when that physiologic function is not working, we should really dig deeper and kind of consider it a vital sign for that mom and baby dyad. Why is that baby not able to do that? Why is that mom struggling? And it may or may not be completely fixable, but we're putting her onto the path of wellness. And sometimes we do get it corrected, and she has a much better experience with her second or third child. So that's really what I'm passionate about.
Mhm.
And
Oh,
that's
amazing.
again like why I feel that, I've been led to kind of get extra trainings and help at a little bit of a deeper level than I was before I had my MP degree.
That's great. To be honest, I didn't realize that you even did all of that in your practice. So that's so good to know from my
Yeah.
standpoint too. So that's good. I know we've talked a lot about you, maybe treating some of those older kiddos, of course, women. We want to dive in a little bit more into like your actual practice and service. So however way I guess you want to start that, can you kind of tell us like from a lactation side? I guess we can just kind of start there because I know a lot of our listeners are moms or soon to be moms. Can you tell us maybe a little bit about the lactation consulting side, what services you provide there, most common things that you might see as a lactation consultant?
Sure, absolutely. So, from the lactation side, there are about four of us in Indianapolis who provide lactation services outside of the hospital. So, when you go to deliver at the hospital, there usually are some lactation consultants on staff, and they're going to see you in that 2 to 4 day period postpartum. And again, they might be getting you off to a good start, talking about kind of expectations, how much, how often, how to know the baby's getting enough. But if you asked me again, where sometimes we lose our breastfeeding success rates is once you go home, parents are like, oh man, how do I navigate this? And obviously, a 1-month-old or a 2-month-old or a 6-month-old has different challenges than a 1-week-old. So that's really where private practice lactation consultants are, parents are seeking out a private practice lactation consultant that makes home or office visits. And that's my practice. So a patient that is, seeking lactation care, they would just go to my website, go through my contact. They can email me or text me, and then I set an appointment time with them. I also see patients prenatally, and that would be a big key advice that I would give is that it's great to see people before they're having issues. And I meet with a lot of my patients prenatally to kind of talk about, here's some keys to success. I'm looking at their medical history. I'm doing a clinical breast exam. We're talking about what's on their mind. Maybe they don't have intention of directly breastfeeding, but they want to know how to exclusively pump, so that I can just give them like the best information and kind of help meet their goals, I guess you would say, with their own baby or return to work or whatever, their top concerns are. So we do meet prenatally with a lot of patients. And then I usually see my patients anywhere between 2 to 6 times postpartum. Sometimes it's more, sometimes it's less. We do have some insurance plans that cover outpatient lactation consults. So like I'm in network with Anthem and United Healthcare and Cigna. And so sometimes those visits are completely covered. If not, then they are a self-pay patient via their credit card or HSA card. And so that's kind of like how they set up an appointment, how it gets covered, either insurance or self-pay. And then, at a lactation consult, we're usually spending 60 to 90 minutes at an initial visit to watch a complete feeding. I'm doing a health history and feeding history with mom and baby, and then we're weighing the babies before and after a feeding to kind of see what are they transferring. So that's like our chief way. And I would say a lot of parents are like, how do I know the baby's getting enough, right?
Yeah.
So that's one of the chief ways. We can put baby Isabel on the scale and she weighs 7 pounds, 10 ounces. She goes over and feeds with mom for 20 minutes. And then she weighs 713. And we're like, look, she gained 3 ounces.
That's awesome.
Yeah.
That's a cool way just to be able to like watch it from like start to finish there. Do you feel like, are you certain like you're seeing more people that are already established with you, or are you seeing a lot of like acute visits for lactation, or is it a good combination of both?
I would say it's a good combination of both. So I definitely get a lot of first-time people. They're like, my sister recommended you, my friend recommended you. I'm totally new to this. I don't have many expectations or know what to do. Somebody just told me like, I need to see you because you were a key to helping them get off to a successful start, or like turn the ship around when we were headed in the wrong direction. So I will get those referrals. And then when I meet people like you and other professionals, I definitely get referrals from physicians, other nurses, lactation consultants in the hospital. I work a lot with chiropractors who are doing pediatric chiropractic work, and we can talk about that a little bit. And also many dentists in my world of like referring for tongue tie and lip tie and myofunctional therapy that I do.
Yeah, I would love to hear more about that. That's a perfect segue, because that was literally my next question I was going to ask you was talking a bit about myofunctional therapy. I know we talked about it before we started recording, but I guess kind of how did that just kind of fall into place with doing the lactation consulting side, or did that did you come about seeking out doing myofunctional therapy because of your own personal interest?
Well, I'll just tell you a little story about that
Yeah.
if I can.
Yeah.
I was at a conference that it was one of my first international conferences that I had attended on oral function and tongue ties. And that was in Canada back in 2014. And at the beginning of the conference, they just kind of like did this, like scan the room, like, who's from Canada? Raise your hands. Who's from the US? Raise your hands. Who's from the Midwest? And there was only two of us from the Midwest. And so then we like walked up to each other afterwards and she's like, I'm in Indiana. And I'm like, wait, I'm in Indiana. And she's like, well, I live up by South Bend and I live, in Indianapolis. And I was telling her what I did with babies and tongue tie and had just started my clinic at that time. And she's like, you really need to know more about myofunctional therapy. I'm working in this orthodontic office and I drive down once or twice a month to see her patients. And I can't find anybody to see older kids and adults. And I'm like, well, I don't know that much about myofunctional therapy. I've heard the term, but I don't know what that really entails, for assessment wise and therapy wise. And she's like, well, I'm inviting you to come to my office so you can learn more and I'll send you some information. And she was really good about doing that. And then I met that orthodontist, and that's really where I learned about teeth. Before, nurses learn very little about teeth. And I'm like, whoa, teeth. They've got numbers, letters,
Yeah.
labial. I was like, what are you guys talking? It was like a whole new language, right?
Yeah.
It was crazy. And so I knew that I had a lot to learn, but I really liked the therapy side of it. That part was good for me. And I, again, like as a nurse, I was like, I'm really good with my assessment skills. I know that I can learn this and kind of recognize what's normal and what's problematic. And so myofunctional therapy really focuses on the muscles of the mouth, face, and neck. And it also focuses on breathing. And so many of the patients who seek myofunctional therapy might have some issues like low and forward tongue posture. The tongue is between the teeth and kind of hanging forward. They might have a tongue thrust. They might be in orthodontia, and the dentist or orthodontist has noted that they have a tongue and lip tie. They are mouth breathing. They have TMJ and upper airway resistance and sleep apnea, sometimes related to how small the jaws are or the space of that tongue and jaw inside the structure. So like when we look at the nasopharyngeal airway, oftentimes we can just hear that they are really breathing heavily. At rest or sleep. So myofunctional therapy does an assessment, and then we have specific exercises that help with better breathing, sometimes what we call breathing retraining. So we can train you how to rebreathe, closing your lips, breathing through the nose more. We can train the tongue's posture. And definitely, in my experience, a lot of these adults and children have a tongue tie that they've dealt with since they were a baby. And if we go back and look at the history, we're like, oh, yeah, you've had this going on for a while. Your mom wasn't able to breastfeed you. She then had speech issues, or you were a picky eater. Or the child was a picky eater. They went on to have, issues with orthodontia. And then somebody somewhere says, like, has anybody told you have a tongue tie? It's really affecting your life.
Yeah.
And then that's kind of where I come in to help pre and post frenectomy, prepare them and get that better retraining of the muscles of the face and neck. Traditionally, myofunctional therapists are typically a registered dental hygienist or a speech language pathologist, because they're also looking at swallowing like we do. They're in the mouth a lot, or they've dealt with kids who have speech issues. And then again, somebody says, has anybody told you that your child has a tongue tie? This might be why they've been in speech therapy for 3 years and making no progress.
Yeah.
So there are a few nurses, doctors, physical therapists, dentists who also have that certification in myofunctional therapy. Um, I just say I'm a little bit of a unicorn because you don't meet a lot of nurses who are doing it. But I think we're well equipped to do it, and it's definitely within our scope of practice. Once we have training and an assessment, we can do that.
Definitely. I feel like it fits right in too with already what you're doing anyway.
Yeah.
It's like right in
It
your
does.
wheelhouse of passion. So
Right.
that's perfect. It sounds like too with the tongue tie issue, you're seeing maybe older adults too that struggle with it versus just babies and kiddos.
Yes, for sure. They're a smaller part of my practice, so I would say that I see probably 2 to 5 a month, and most of them are being referred by their treating dentist or orthodontist.
Mm.
And so that's, kind of how they come to find me.
Yeah.
The other thing that I'll share with you guys too is that I teach classes for other nurses and lactation consultants. So
Oh, that's cool.
yeah, about 6 times a year, I go to different cities. Someone hosts me at their place of work or a public, meeting house or something like that. And usually we have anywhere from 20 to 40 attendees who want to learn these skills a little bit more deeper. So stronger assessment skills related to how to assess for a tongue and lip tie, myofunctional therapy, oral exercises. So I always say it's kind of like IBCLC 202. It's like that next level of like, okay, you're taking care of the basics as lactation consultants, but if you wanted to learn a little bit more to dive into the complex, then I just saw that there wasn't that much out there for other people to go learn formally.
Is there like a registry or anything like somebody could go on and look up to see who is who's registered in the myofunctional therapy? Do you know?
Yes, both IBCLCs are certifying body where we take our board exam and then, renew just like we do as nurses our like CEs or credit hours, like learning credit hours.
Yeah.
We have a registry for IBCLCs, and then there are 2 registries for myofunctional therapists. So like I'm on one myofunctional therapist registry, and every once in a while I do get people who are like, hey, I found you through that link. And I'm like, oh,
okay.
it does work.
Yeah.
Perfect. Glad you found me.
Yeah, right. I was wondering, like, for listeners out there who, they might not be close to Indianapolis, but if they, could find somebody in their area who, if they're like, wow, this actually sounds like me, maybe this is an issue I've been having. So,
Yeah,
okay, that's great to know.
absolutely. So like one of the listservs is myofunctionaltherapist.com.
Oh, that's
So that
easy.
one's easy to remember, myofunctionaltherapist.com. The other one is the International Association of Oral Myologists. So that is a myofunctional therapy professional group, IAOM. And I think it's IAOM.org. And so if someone was interested in getting training, there is, an additional training course, and we have to submit case studies and write some papers and do things like that to like pass your test to become certified. But then usually those professional certification groups are the people who have the listservs. Like, hey, these people have done their work. They are qualified to see patients, and you could look under, Alabama or Indiana or wherever to find a lactation consultant or a myofunctional therapist, depending on what you're looking for.
Okay.
Oh, that's great. Yeah, thanks for all that information.
Yeah.
I feel like that's super helpful for people to know.
Yeah, I'd be glad to give you more resources if you guys need that for a later date or you're posting it anywhere.
Yeah, that would be great. We're always looking for, of course, in our specialty, people to refer out to, and reliable folks, but also people listening, reliable providers.
Yeah, definitely.
Yeah.
What do you feel like, I'm going to ask you a question in regards to lactation. What do you feel like is the biggest misconception you hear regarding lactation and breastfeeding?
That's a tough one. Oh man, there
It
are
can be
so many.
multiple.
And it could be a few. You can choose like your top 2 or 3, whatever you feel like talking about.
Yeah. Well, there are a lot of myths surrounding like what makes milk and what doesn't make milk. And so, again, the process of lactation is a biologic process.
Mm-hmm.
And babies really do come well equipped with natural infant primitive reflexes, such as the sucking reflex and the rooting reflex and the head righting reflex and hand to mouth signaling to tell a parent, hey, I'm hungry, you better pick me up and feed me, right?
Mm-hmm.
But I think that we've lost culturally sometimes of seeing other people nurse their baby up close and personal. And when we grew up in villages, or even an old lady like me who would go to like a La Leche League meeting, when I first went to one, there was some value in seeing other mothers feed their baby. You see
Mm-hmm.
how they hold their baby. You see how they're interacting. They're kind of telling you like the real story of like, sometimes this sucks, like I don't actually like it, or this was
Yeah.
painful at first and I worked through this. And now, of course, that space is online, just like you guys spreading the word with your podcast, right? But
Mm-hmm.
moms aren't always meeting in community directly.
Mm-hmm.
And so I feel like that is a real challenge to breastfeeding, even compared to like 25, 30 years ago when I nursed my own children who were, they're now young adults, except for one who's 13. And we've lost that sense of like, it takes a village sometimes to have
Mm-hmm.
some of that support. We're really good about like the medical side. And I also think like there's a lot of information on TikTok and Instagram and the internet and podcast, but that is meant to not replace a professional's insight the way that I've told you.
Mm-hmm.
Like these days, moms will be like, oh my gosh, I need to be pumping more. And I'm like, okay, tell me why you think you need to be pumping more.
Yeah.
And they're like, follow this girl on Instagram and she's got like 1,000 ounces in her freezer. And I'm like, that's a lot of milk. And
Yeah.
not every person is going to need that much milk, nor are you going to make that much milk.
Mm-hmm.
But that's what young women are seeing as like, the goal
That's the
is that I
standard.
need to, yeah, that's the standard, because some influencer decided like, hey, we should all have tons of milk in our freezer.
Yeah. And that's the hard part, because they just like to compare themselves. And that is my
So
pet peeve
sad.
when someone starts a sentence with, well, I saw on TikTok, or I saw on Instagram, or I saw on Google. And I'm like,
Yeah.
oh gosh, here we go.
Well, let's just erase all of that because
Yeah.
it's nonsense most of the time.
But
Yeah. And there really are some good benefits of it. Like, I think that it's brought awareness to like the issue of tongue and lip ties.
yeah.
For
Yeah.
sure, that awareness is there because of social media. 15 years ago, when I really started knowing a lot more about tongue and lip ties, we had a grassroots effort on Facebook to put more information out there. So, like, I was in charge of the Indiana tongue and lip tie group. And I would try to connect people with like, who can you see in your little town north of Fort Wayne? Like, I've never heard of Angola. Like, who's in Angola? I don't know who's in Angola.
That's awesome.
So that was like an example of like how to connect people to resources, which is
Yeah.
really important. And social media definitely does that. So again, like you guys know, working in the medical space that you are, if a mom or a patient, let's just say a patient, has an issue that's unique to them, let's say it's breast cancer, they can find a group online and that person's like, oh, I can find you a breast surgeon in Arizona.
Oh, 100%.
Yes.
They're on the internet, they've got somebody. Or
Yes.
this person was who helped me the most with my physical therapy or my lymphatic drainage massage.
Yeah.
Whatever it is. So I do feel like that's where the gold is in social media, but
Mhm.
that doesn't replace the expertise. So I think that's a real challenge, I guess, going back to your original question of like, what's some of those big misconceptions? Don't rely just on social media, of course,
Yeah.
to get your help. Um, definitely seeking out a lactation consultant prenatally and after you go home can be a really good key to your success because we can, tell you when we're concerned, but then we can also tell you, like, you know what, you're doing really good. Your baby looks
Mm-hmm.
great. I see good weight gain. I see good milk supply. Hey, let me tell you about pumping in preparation for going back to work.
Mhm.
Your baby's 6 months old. Let me teach you what I know about introducing solid foods and continuing to breastfeed for the rest of the year.
Yeah.
Mm-hmm.
Um, and then I would guess the other top challenge, I think, is that among medical professionals and even non-medical professionals, but probably among medical professionals, is that we forget that it's not always about trying harder, working harder, and breastfeeding would just work out, right?
Mm-hmm.
It is a biological process with a lot of biomechanics and a lot of hormone and a lot of different things. And sometimes mom is doing everything she can to like tweak her milk supply, but nobody's looked at that root cause of perhaps hormonal dysfunction or insulin resistance. And someone telling her to eat lactation cookies is like, come on, we would never say that to somebody else with a complex medical issue.
Yeah.
And
Yeah.
again, that's where I think the expertise comes in of making sure that medical professionals, just the reason why I think you guys had me come on is to say, hey, we know who to refer you to. That's not our area of expertise. And it's the
Mm-hmm.
same. Now I know you, I'm going to collaborate and send more of my breast abscess cases your way because
Send
Thanks.
them over.
I'm not doing those all the time, right? So it's all about collaboration, but when you really
Absolutely.
start to um, talk to patients more, I think, they're like, I've seen 4 or 5 people and nobody's been able to like really fix my issue.
Mhm.
And,
Mm-hmm.
and they've been given bad advice, and sometimes they're stopping short of their goal, and
Mm-hmm.
maybe could have helped them more if we known about it earlier or got a referral outside of how it typically happens.
Yeah.
Yeah. And I don't know about you, I'm sure you do, but we see a lot of new young moms and their baby's really, really young, like not even a month old.
Yeah.
And they're just so stressed, and this additional, like they're having lactation issues, they're having mastitis and things like that. And they're just so overwhelmed with, on top of like, just doing their best to take care of their new baby. And
Yeah.
so, do you see quite a bit of that then? And how do you manage, I suppose, like their emotions and like supporting them through that?
For sure. I think I coined a term that we're no longer lactation consultants. We really are lactation therapists
Yeah.
Yeah, I
because a lot
bet.
of times, and we know this in our nursing role, but a lot of times we are doing some hand holding, or
Mm-hmm.
I have some mental health concerns, like this mom is really struggling, so then I'll
Mm-hmm.
give her an inventory to check, like, okay, do you have postpartum depression or anxiety on top of, yes, we know that it's hard to have mastitis and feeding, but then I need to make a referral
Mm-hmm.
because I can't treat mental health, so I'm referring in that situation to a therapist or a psychiatrist. I might get her going as an NP with, some basic SSRIs or
Mhm.
Mm-hmm.
anti-anxiety meds, but she's really going to need some more detailed help beyond me. But I would agree with you, Cassie, for sure. Um, Moms are stressed. I think we should do a better job about talking how difficult that transition is
Yeah,
postpartum.
I totally agree.
Everybody's focused on the birth, right? And
Mhm.
having the best baby shower and the best reveal and all the things,
It's
again,
so
probably
true.
driven a little bit by social media. But usually, like when I talk to young moms and then even my older children who are in their 20s, I'm like, okay, well, let's talk to her about like getting a a fund set up for postpartum care,
Oh,
or
yeah.
a meal train or a nurse helper. Like there's newborn care nurses that will come for 4 hours. Because the other thing, besides just young moms, but all moms,
Mm-hmm.
um, isolated a lot from our families. Maybe I moved here with my husband and I know nobody in my neighborhood, and I don't really have somebody if dad's back to work and I'm by
Mm-hmm.
myself all day to kind of, help with my mental health or just get out of the house, get a break, get a
Yeah.
shower, get a meal. And again, like social media would make it sound like life is great. Here I
Right.
am. I look perfect. I've done my hair, my nails, and my baby is doing just great. And then you dig a little deeper and they're like, I'm not getting any sleep. It's really hard. Is anybody out there feeling like this? So I do think that mental health piece is big, and
Mm-hmm.
we are doing a better job of screening for sure.
Good.
So the ACOG guidelines with the American College of Obstetricians, we knew that waiting 6 weeks for the first postpartum visit was too long. We can miss a
Mm.
lot in 6 weeks,
Yeah.
right?
Mm-hmm.
Pressure issues,
Absolutely.
hemorrhaging, all kinds, infections. And so now most providers are bringing patients in at 2 weeks, or at least their nurse office staff is
Yeah.
doing a very detailed phone call at 2 weeks. And they're asking those questions. How are you doing physically? How are you doing mentally? How's your baby feeding? And then hopefully they are connecting them to resources or bringing them into the office to get more detailed care.
Mm-hmm. Oh,
Yeah.
that's great. That's great to hear that they changed those guidelines, and it's like actually recognizing it that moms need help too.
Yeah.
Moms
They
need a
do.
little bit more care after in the postpartum phase as well.
Yeah, that's such a struggling period of life. Like you said, like if you're home alone and you don't have much help at all, like these women are struggling hard. So even some of those things you mentioned, like getting like a home, like that nurse aide for a few hours of a day, like this is why we talk to you, because like some of these are the things that we don't know, and people out in the wild don't know either. So that's,
Sure.
amazing things to think
Yeah.
about.
And I think the other thing that I see that's a big shift is also fathers. Fathers are really involved with their babies compared to maybe our parents or grandparents' generation, right?
Mm-hmm.
So there's a lot more working parents from home. And so, mom's support partner is often with her a lot more, and they're very involved in the care. So I'm just like, a lot of dads come to the consultation, the
Oh,
lactation
good.
consultation. They're wanting to know what they can do to help their partner.
That's great.
Um, so I think we're doing a better job of just like looking at everybody as a unit and realizing like, well, dads have needs as well. Parents in general have
Mm-hmm.
needs in that postpartum period of making this transition of caring for a human, making sure you're getting them off to a good start. And they feel some of that stress too. And sometimes even more so because they feel helpless, right? I know my
Mm-hmm.
wife is struggling with pain, mastitis. She really wants to breastfeed. I don't know how to help her. And so support partners, are really nice to meet prenatally as well. So we can tell them like, okay, here's ways that you can help directly. And then here's some of those maybe red flags of like when you should be concerned and kind of intervening, working together with her. But like, hey, honey, I know that you're off. You're not right in how, things are going with how you normally are coping.
Mm-hmm.
How about we make this call, to Lisa or another mental health provider like we've talked about. So if they have the resources, I feel like they get the help much more quickly or sooner,
Mm-hmm.
where sometimes if they haven't gotten many of those resources, it takes a while for them to kind of travel through the rabbit hole to be like, finally, I found somebody who can like answer my question or, do that.
Yeah, absolutely. That kind of brings me back. Like, I'm glad that you see them, in the prenatal time, because then you can lay out those, if you see X, Y, and Z, that's a red flag, then we should enlist more help or should be reaching out or getting additional help,
Yeah.
I suppose.
Yeah, and that's really a focus that has changed prenatally. I think when I first started teaching back in the early 90s, it was more of like convincing people to breastfeed, and here's all
Uh-huh.
the benefits. Well, parents these days, they often have been breastfed themselves and they know all about the benefits.
Ah.
I'm not having to convince people to
Uh-huh.
breastfeed. They have intention and want and are breastfeeding. But how do we help the exclusivity? How do we get a baby breastfed for 3 to 6 months without all the problems or
Mm-hmm.
introducing formula or helping parents reach their goal? That's really where we win more of the health benefits, in my opinion, of why we start out with intentions to breastfeed our baby.
Mm-hmm.
We want that bonding. We want, good health for our babies. And a lot of parents know about the benefits. And I always say, I can't tell you how it happens, but I know you're going to fall in love with your baby.
Mm-hmm.
It just takes a while to like read their cues and learn their personalities and learn, is this, I just pooped my pants cry? This is I'm hungry cry. And it takes a while to learn that, right? If
Yeah.
you've been in any relationship, you're like, oh yeah, I can read you a lot better now. Like,
Right.
yeah, I know not to mess with you for an hour
Yeah.
until you've had your downtime.
You're exactly right.
Just
You
give
have
it
acid
time.
reflux.
Yeah. So I think that is a unique shift to
Yeah.
prenatally, is that people are like, give me resources. What do I do if X, Y, and Z happens?
Yeah.
If I can't latch my baby on, can I try a nipple shield? If my baby doesn't latch on, should I start pumping right away? They
Mm-hmm.
ask me very good questions now because they are in that mindset of like, I want this to work.
That's
Mm-hmm.
great.
Mm-hmm.
And I love that part of it.
And maybe that's where like social media has been kind of helpful too. Like shifting that mindset of like, let's breastfeed, let's do it, and you can work through these issues that you're having and being more vocal about their struggles, I suppose, online.
Yeah.
Yeah.
I have a question for you guys.
Yeah.
Oh, yeah. Let's hear it.
Because I mean, we've talked some, but I would like to know more about some of the challenges that you guys are seeing in your offices and kind of like what that view or perspective is from your side of things. Like what do you feel are like some of the top needs or some of the top, I guess, concerns or chief complaints that are bringing patients into your office?
I don't know, I think we can speak for both of us, but mastitis is a huge, huge issue. And I think like a misunderstood treatment regimen that we see patients for. We actually had a breast surgeon who's an international board certified lactation consultant, Dr. Katrina Mitchell. She was on the show a while ago, and we have kind of taken hold a lot with her direction and her guidance on treating a lot of breast issues. So like mastitis is a big one, and not understanding like breast rest and using ice and cold cabbage leaves, and just kind of taking a step back a little bit, treating like the acute issues of breastfeeding. And like Cassie said earlier, I think a lot of it too comes like with the overwhelm of being a new mom and wanting to feed the baby and maybe wanting to get to the certain amount of milk supply when everybody's different and everybody is so unique, and just trying to counsel them through that.
Yeah. And I think too, by the time they see us, they've been dealing with this for weeks. And so a lot of times we see them once they've already have an abscess, they have a big open wound, or they're just feeling miserable because it's not getting actually taken care of. Right. And just the misconception too that a milk plug, you can like massage it out, and then it just, makes the situation so much worse. And so unfortunately we see them probably a little too late, honestly. And so we've even tossed around maybe one of us or both of us becoming lactation consultants as well, because unfortunately our hospital just doesn't. Our hospital provided lactation consultants just don't seem to do a great job, and maybe it's just because it's the 2 to 4 day. They only see them for such a short period of time, and we're seeing them, weeks or months out.
It's short supply, I would say, of like having a good like a lactational consultant like group that you can just like send to and count on, versus like we are a breast care service. And so it would make sense if one of us just knew how to handle and do it better from a lactation consultant standpoint, and like truly be able to sit down, like you said, for an hour and watch through it all and see how it goes.
Yeah. And like you spoke about Dr. Katrina Mitchell, and the Academy of Breastfeeding Medicine changed that protocol in how we're assessing and treating plug ducts and mastitis. So, sometimes I kind of laugh and I think like, well, I haven't used warm heat on a hot infected breast in a long time, because just my nursing sense is like, we wouldn't do
Why
that
would
with
you do that?
cellulitis. Like
Right.
we would never put a heating pad on
Yeah.
cellulitis.
You're exactly
We're
right.
letting massage around this infection, right?
Yeah.
That didn't make medical sense.
Yes.
It really didn't. And so, unfortunately, sometimes in women's health, as you guys know, we sometimes do things that don't make sense. And a woman is crying out like, help me, I've got the symptoms, but I've been mismanaged a little bit.
Yeah.
Because people may not be up to date with the protocol. And it makes sense. If we've got inflammation, we want to decrease inflammation by cold, elevation, ibuprofen. We want to take care of infection if it's beyond that 24, 48 hours and we've got a high fever. I am advocating antibiotics, because sometimes that's going to get them better.
Yeah.
The other thing that I see a lot of mastitis and abscess cases too, is that they've given them like amoxicillin, and they've been on amoxicillin for 5 to 7 days with no symptom improvement.
Yes.
And I'm like, well, has
Yes.
anybody considered that this might be MRSA, or that this might be a
Right.
different type of bacteria, and we actually need Bactrim.
Yeah.
We actually need clindamycin.
Yeah.
And so knowing what those first lines, and again, getting into our medical mind for those of us that can really assess, prescribe, treat, and say, if a treatment is not working in 3 to 5 days, you've got the wrong treatment or the
Agreed.
wrong diagnosis, and let's switch gears.
Yeah.
And if I've helped that patient to the best of my ability, I need to refer them out, even if I'm quote only a lactation consultant who can't treat, right? I can educate my patient to say, look, you've been on an antibiotic that whoever prescribed for you, you're not any better. I want to refer you to the breast care center, because they can give you more detailed help and look at, okay, do we need aspiration? And instantly the mom's like, oh my gosh, my breast feels so much better.
Yes, it's
Exactly.
And you guys have seen that, I'm sure.
Oh,
You're like
1,000%.
40 milliliters of aspirin, and you're like,
Yes.
like, what's going on?
We love it.
It's almost
I
like
know.
I wish that if
The
somebody
great details that we love.
Yeah.
I know. I wish that if somebody did have like an issue in breastfeeding, like if they were having like their first true episode of what they think mastitis would be, and if that provider they're seeing, notoriously it's an OBGYN, if they think that they need an antibiotic at that point, sure, go ahead and prescribe it, but like put a stat referral into us right away so we can be on top of it sooner. A lot of times, like these patients don't need an antibiotic if you catch it soon enough, which is even better. So it's tough. It's really tough.
It is.
It's all about
Tough. And
education.
we have to,
Yeah.
we have to, look at every patient that's before us. They are a unique dyad. And I think that's the other missing piece sometimes, is that in my experience with like abscess and repeated mastitis, oftentimes that breast isn't getting emptied well or regularly because the baby is struggling, right? So if I have a baby who has a tongue tie and can't latch effectively and can't relieve that full breast or go from feeding well to, here's the mom who naturally is going to have a full breast. It's been 3 hours since the baby last fed. The baby latches on, they feed well, and mom knows the milk left her and went to her baby. When my baby is struggling, if the latch is pinching, clamping, causing the nipple to kink, that's where I'm going to get a nipple bleb. That's where I'm going to get the start of clogged milk ducts. Now I've got mastitis because it's festered for 2 and 3 and 4 days, and we're still not emptying the breast. We're going to see that repeat if we're not kind of getting to the root cause, which often is the baby.
Yeah.
Now, certainly there can be mastitis without tongue tie or oral function issues. And I find that sometimes those cases, the mom may have a lot of systemic inflammation in general. She's prone to, like she has a history of IBS or Crohn's or autoimmune, and it doesn't take much for her histamine and levels to just go from 0 to 60.
That
And
makes
so
sense.
then we're kind of dealing with that, and it's not always, and we might employ different things that Dr. Mitchell isn't talking about. She's a breast surgeon. And if you go to her physician's guide to breastfeeding, it's great for a breast surgeon to be like, how do I do this aspiration technique or this debriding or what I need to do from a surgical case? And encouraging those moms that most of the time they're still going to be able to breastfeed. We might have an interruption. We might need help to figure out how to do it with this gauze on or dressing changes. But we usually can continue to breastfeed. I think in functional medicine, we would look at how do we reduce that histamine systemic inflammation in general. Like, sometimes I'll prescribe like a histamine blocker. This is a supplement to get those histamine levels down. We will prescribe or recommend like a probiotic to get that biome of like good bacteria fighting off bad bacteria, because there is some like dysbiosis inside this breast microbiome. That can be a big factor too. And then, I would say I'm not against a gentle massage and movement, where Dr. Mitchell tends to be like, no, never massage. And I will never say never.
Yeah. If it works.
If it works.
Helps.
But gone are the days where most women were not treating their breasts kindly, as my friend says, right? They're like digging and thinking that this is like a clogged pipe that you just have to push it through, right?
Yeah.
And you think about the breast structure and what it looks like anatomically, we've got 5 to 10 nipple pores that open and then ductwork that goes out from there. And it's the inflammation that closes off the duct or the milk flow surrounding the tissue. So if we can gently move when it's not infectious, but maybe we've caught it early, like you were talking about, doing some gentle breast gymnastics, doing some soft massage, teaching a mom how to hand express in addition to maybe pumping. She may not always need to pump, but she actually needs to get her hands around her breast because our hands are healing. They really are. So I will do some gentle breast massage, some hand expression techniques, and some other things in addition to helping patients with frequently plugged ducts, mastitis. I would say true infectious, like, hey, we've got 102 fever, you've got a hot swollen red breast or a walled off abscess. We're like, yes, do not massage your breast. We do not. There's a reason why that is walled off. We want it to stay walled off. We don't want to spread it and you have sepsis. But there is a place for moms to be able to help themselves, interim until they do get in to see you guys. And I would say like the breast care center, and I think another breast surgeon that I'll sometimes refer to, the problem that when I teach classes in other cities is like we only have 1 or 2 breast specialists in our town. And a patient will call, they've already been to the ER twice or whatever, and they call the breast center, not you guys, but a breast center, and they're like, we don't have an appointment for 2 weeks. And a mom's like, what?
Yeah.
And so I found that when I started my own practice, I had to knock on some doors and be like, hey, my name's Lisa. Hey, Heidi, I understand you're there. What if I have a mom? Are you guys able to work her in a more timely manner? Because I've checked all of my boxes and how I know to help her. I've got her started on the antibiotic, but I'm really feeling like we need to, create an appointment for her because she might be at that point of needing ultrasound or abscess aspiration.
Yeah. Definitely. We're always open to
open books.
throwing
we're
people
always taking
on,
people add-ons.
Yeah, by all means, if you ever have a patient that you want to see quickly, you can always give us or our surgeons a call, and we're all pretty good. We have time in between surgery or sometimes at the end of the day, or we see patients over lunch randomly all the time because we do get a lot of, abscesses that come from the emergency department and dealing with those. So
it's just finding somewhere that does. So
absolutely.
If you need anybody, reach out to us.
Yeah, I definitely will.
Oh, well, it's been so great talking to you. It really has just a wealth of knowledge. Is there any last piece of advice you want to give to ladies out there?
I would just say to new parents in general, seek your circle of support early. Find out what's important to you. Are you going to birth with a midwife or a physician? What are your options in your town or your area? Go and meet those people. This is somebody that you want to have that connection with too. That's the other thing I like about meeting people prenatally is that when we connected like we do, I have a face now with Cassie and Heidi, and I'm like, oh yeah, I know Cassie and Heidi. I can refer to them. It's the same for parents when they have some meet and greets of a doula or an OBGYN, a lactation consultant, then they're going to be more apt to call them early and often so that hopefully we're avoiding a lot of the cases that we've just talked about of like, let's help you before we get there. Or if we are there, we're helping hopefully the severity because we got more timely expert care. Right. So that would be my big advice is that I wish that people, when they are starting to think about having a family, that you really make some good decisions kind of leading up to almost like what we call preconception planning of just like, hey, let's give this a thought for 6 months, where sometimes, and life happens, right? But sometimes, we're like, hey, I need an OB. I don't know who to go to.
Yeah.
Or we out like the favorite OB that my friend has recommended is not seeing new patients. Well, who else is out there? So I feel like resources, getting those things early really gets parenting off to a much better start.
I love that. Yeah, I totally agree.
Where can the people find you? Do you have a good website, Instagram, social media? Tell us where they can find you at.
I could be a lot better with social media. That is
Same.
my forte. So I do usually refer people to my website. So that is right now, that is Advanced Breastfeeding Care. So if you just went to www.advancedbreastfeedingcare.com, you're going to find me. Or if you Googled my name, you're going to find me. That's the best way to reach out, professionally or for patients personally to set an appointment with me. After that, I'm very good at using social media. So I do use a texting and a portal system to message patients. And like that part of social media. But, sometimes I'll get people who are like, I messaged you on Facebook. And I'm like, oh, well, I haven't checked my Facebook folder and I don't know when.
Yeah.
And that's probably not HIPAA compliant. So I'm not going to, I might say like, please contact my office if I happen to read that message. But yeah, just reaching out to my website, Advanced Breastfeeding Care. I would welcome anybody prenatally, or if they have friends or family members locally, they're wanting some help. Or I'm really good at making connections in other states because of the teaching that I've done. So if you're like, oh, my college roommate is pregnant in Connecticut, I know a lady who could help her for sure.
That's good to know.
Awesome. Yeah. And we can add that in our show notes too, so people can easily find it and click on it if they want to. So yeah, thank you so much for being here and being on. It was a pleasure to virtually meet you and to hear everything you had to say. So it was great.
Yes, thank you for inviting me, and thanks for your time. And I look forward to maybe talking to you guys again, either in person or again on the podcast.
Yes, sounds
Perfect.
great.
Yeah, thank you so much.
All right. Have a good night.
You too.
Bye.
The information that you hear on this podcast is not a substitute for medical advice. As always, please seek out personal care and advice from your medical team.